Hi, my name is Dr. Christina Charlotin. I am a licensed clinical psychologist. I see clients in my office, which is located in downtown Los Angeles, and I also see clients online, both clients that live in and outside of the beautiful, amazing city of LA. So today we're going to talk about how to care for our mental health during this period where we are going through this coronavirus epidemic. I thought that this would be a good video to make just because there's so much information out there about what to do to protect our health, to protect us in a physical sense. But when it really comes to the emotional stressors that we might be experiencing, the mental health symptoms that we might be experiencing, there's just not that much information out there. So I thought that this video could possibly help some people. So I'll start with this. I think that this is an important period to really recognize and remember that to some degree or another, everybody around this globe is affected by what's happening right now. So I think sometimes it's really helpful to just keep in mind that we're not in this alone. You know, never before in our lifetime has there ever been a global stressor that we're all sharing at the exact same time. And I think sometimes it helps us connect with a sense of comfort when we remember that, you know what, this stressor, this is not just my stressor, it really is everybody's stressor right now. So, I think that probably the most common emotional experience that people are having right now is the experience of worry. So let's talk about worry. Worry or anxiety. So worrying, it serves a positive purpose to a degree. Okay? So worrying helps us plan. It helps us jump into action. Once we have addressed all of the actions, you know, and once we've executed all the actions that we can to address whatever the stressor is, worrying is no longer helpful. Once we go past that point, worrying actually does cause a lot more harm than it does good. So, I think a good place to start is really identifying what do you have control over and what do you not have control over right now. Everything you have control over, address it externally, address it with your actions, okay? So the things that you do have control over, you can make sure that you're doing the things to be safe right now. Make sure that you're washing your hands. Make sure that you're maintaining social distance. Make sure that you are still using technology to connect with your friends and family right now so you're not feeling too isolated. These are the things that we can control. The things that we cannot control, we must address it internally. Okay? So what are those things? The things that we do not have control over is the fact that this is happening right now. We can't control that. We also can't control, you know, as an individual, we cannot necessarily control how long this is going to take and when things are going to get better. We also cannot control the fact that this is going to affect our economy. This is also affecting our jobs. Some of us, most of us are working from home right now, and that's likely causing some complications, you know, if that's not something that we do on a regular basis. We cannot control the fact that schools may be shutting down and now we have to study from home, or the semester may be ending earlier than we had anticipated, or the fact that we're not able to continue with our travel plans or hang out with our friends as often as we used to. So, if it's not in our control, it doesn't serve any positive purpose to continue to mentally create frustration around that. So what do I mean by that? Our thoughts are extremely powerful. Our thoughts are basically the way that we speak to ourselves, the conversations that we have with ourselves on a day-to-day basis, from the moment we open up our eyes and wake up to the moment we fall asleep at the end of the night. The average person has around 60,000 thoughts in one day. We have more conversations with ourselves in one day than you will the majority of people in your life that you're close to in an entire year. Isn't that kind of amazing to think about? And if you're somebody who naturally struggles with anxiety, you probably have an even higher amount of thoughts in one day. So it is important to make sure that we are not creating, practicing, recycling thoughts that are going to lead to harmful feelings, because our thoughts directly impact, influence, and create our feelings. So if the thoughts I'm having, if I'm having thoughts that sound something like, if I'm thinking to myself, this is so annoying, this is frustrating, I can't believe I can't, go out, I can't believe I can't see my friends, I can't believe that concert got canceled, I can't believe I can't go to this party or this event or this club right now, I can't, or I have to work from home, and it's hard to work from home because this is not the environment that I feel comfortable working in. I hate the fact that, I have to take these classes online, and it's really hard to navigate, the rest of the semester as a result. If those are the thoughts that I'm creating all day, every day, then I am going to feel frustrated. I am going to feel annoyed right now. If I'm having very anxiety-inducing thoughts like the what if, the catastrophizing, what if this happens, what if that happens, what if I get this, what if everybody around me gets this virus, what if we all start, getting really sick and this and that, then I'm gonna feel anxious. If I'm having thoughts that are maybe something around like, I feel really lonely right now. This is really hard. I'm not good at being by myself for this amount of time. Then I'm going to feel really sad, and that's going to enhance my feeling of isolation. So whatever thoughts we're having, they are going to lead to a feeling. And the more we practice and recreate the same thoughts, the more automatic they become, and the more they become ingrained into our overall personality. So this is a moment to really be mindful of the way that we are speaking to ourselves and identify what is it that we would like to feel right now in this moment. If I want to feel safe, happy, and secure, then it's important that I speak to myself in a way that's going to contribute to these feelings. Okay? So how do we do that? When we find ourselves having the thoughts that lead to harm, it's important to catch those thoughts and modify them to ones that lead to an opposite feeling. I think this is a perfect moment to identify with a feeling of gratefulness. And I know it doesn't seem like it, but there's so much to be grateful right now. Okay? If you're somebody that's young, if you're somebody that's healthy, then you're blessed right now. You're at a much lower risk level than somebody who is twice or 3 times your age, or somebody that does have pre-existing conditions. If you are in the United States or in another in a developed country, then you are also very fortunate right now, because you are more likely to have access to healthcare services and access to other types of services that can make this period more tolerable and easier, and that will allow you to have the services that you need should things get to a more concerning level. There are a lot of people right now in this world that are in much more impoverished countries, that are much more underdeveloped areas, that are in much more heavily populated areas, or areas that aren't as clean, where they are more susceptible to germs and things and viruses that can lead to getting sick. So that is something to really connect with right now in this moment. If you are somebody who you have the financial security to be able to buy the groceries that you need and the supplies that you need and pay your bills in this moment, then you're blessed. A lot of people aren't in that position. If you have the luxury of being able to work from home and you are not a healthcare professional that is, working hours day in and day out at the hospitals right now, or you're not somebody who, works at a grocery store and is putting themselves in an environment where they are in frequent contact with many people, putting themselves at a higher risk level, then you are also blessed in this moment. And this would be a good moment to really connect with a sense of gratefulness that we do have these amazing people out there that are providing the services that are helping us get through this moment. I think something else that's really helpful is really identifying, so if I'm in a good position, who do I know around me that could use help right now? Do I have an elderly neighbor, and can I contact her and ask her if it would be helpful if I got her groceries for the next 2 weeks? Could I help out this family member? Could I lend a friend $100 that just got laid off right now, or is in a really tight financial position and probably doesn't have the financial means to really buy groceries for the next few weeks? So when we allow ourselves to help other people, it helps us connect with a good feeling, and it helps us take that focus away from us. So I think in this moment, it's important to really ask ourselves, are we focused on what's not going well in our lives, and are we focused on our stressors? Or are we able to focus on all the good and positive things and things that we can be grateful for right now? And that is really going to shift how we feel in this moment. I think something else that is really helpful right now is that a lot of people are experiencing boredom and cabin fever. And I want to start off by saying that if that is your biggest problem right now, then that is something to be grateful for. Because that is a problem that a lot of people right now would love to have. But nevertheless, boredom is still unpleasant. So what do we do about that? If you're like most people and work consumes much of your life, or school consumes much of your life, we are so used to that being the thing that we have to think about all day, every day, that this moment can feel a little unsettling if your productivity has been significantly cut. But we can make that into a positive thing. This could be a moment where we really identify what are the hobbies, what are the projects that I haven't had time to get to for a while that I can really focus on right now. Who are the people that I haven't connected with that I can call or FaceTime right now? For example, right now I am making my very first YouTube video. I've been thinking about making YouTube videos and creating an internet presence for over a year now, but with my busy schedule, growing my practice, seeing clients, spending Sundays, having fun, connecting with my friends, I don't really ever have time. So I'm really grateful that I have this moment where things are slowing down in my practice and I could work towards something that I have been wanting to do for a long time. So have you been wanting to learn how to play the guitar for a while, and that guitar in the corner of your room has been collecting dust? Or have you been wanting to learn Spanish or French for a while? This is the moment to do that. The beautiful thing is that we live in this world where so much is available on the internet. You could literally learn another language, learn an instrument, learn how to do different projects around your house just by looking up videos. So another thing to really be grateful for is that if we have to go through this stage, it is wonderful that we're going through this stage in this time. If this was the 90s, the 80s, any previous decade, things would be so much harder. We would not have as much access to information, and we would not have as many tools that would allow us to either connect with others or be able to do the jobs that we now have to do remotely, or be able to take the classes that we have to now take remotely. So it's great that we have so many tools right now that can help us through this moment. Another thing that I think is really helpful is making sure to limit your exposure to things that feel triggering. I think a lot of people are really, they're looking up, they're watching the news a lot, they're looking up different articles, they're watching a lot of different videos, they're really focused on this coronavirus. It is important that you allow yourself the space to still maintain some of the similar habits and activities that you do regularly in your day-to-day life, and not to be consumed by what's happening right now. So I would suggest limiting any exposure to things related to the coronavirus to maybe once or twice a day. Yes, it's important to be informed, but things are not going to change that drastically from 1 hour to another. You can still be adequately informed and prepared by exposing yourself to information for 30 minutes a day or so, and then disconnecting and focusing in on other areas of our lives. I think also probably something that I think is probably a very, very helpful thing to keep in mind is that this moment will pass. Life will go back to what it used to be. It's important to recognize that what creates anxiety isn't so much the lack of uncertainty or the amount of uncertainty we're facing, or the lack of control. You know, a lot of people, and especially people that struggle with anxiety, they believe that it's the uncertainty that is causing the distress. No, it's your own intolerance to uncertainty. So the goal cannot be to try to create more control, create more certainty. The more we do that, the more we become dependent on control and certainty to feel okay. And that will only lead to temporary relief, but that does nothing to actually address the anxiety in itself. If you want your anxiety overall to improve your tolerance of anxiety. And this is a perfect exposure and opportunity to really do that, because we will probably likely never again face a global exposure that kind of pushes us and forces us into a position to have to deal with uncertainty. So instead of resisting the things that you know are outside of our control or uncertain, create a better relationship with those things. So first, recognizing things will get better. But what we don't know and what we can't know right now and what will remain uncertain is that we don't know when that's going to happen. We don't know where things are going to go before that happens. We just don't know these things. And it's important to really accept that and be at peace with that. And tell ourselves it's okay that right now things are uncertain. It's okay that right now we don't know when things are going to get better, because really we don't have a choice. The more you focus on feeling that this is not okay, this is not acceptable, the more frustrating this period is going to feel, the more anxiety inducing this period is going to feel. And it's not actually going to change the outcome of this circumstance at all whatsoever. It's just going to cause us to experience more distress as we are progressing through the situation. So let's work on creating more of that certainty. You know, overall, it's you know, the anxiety that we're experiencing, it's normal. You know, things are shifting really rapidly. This is not something that we've experienced before. It's okay that these things are coming up. It's natural. It's how we are built as human beings. We just want to make sure that we don't stay in that position. We want to make sure that we jump into action. We do everything we can do to address the things that we do have control over. We continue to connect with friends, do things that make us feel good, relax, read books, watch funny movies, do things that make us happy, and we accept the things that are uncertain, and we keep in mind we are all in this together, and eventually life will go back to normal. So I hope that you found this helpful. If you did, please share it with anybody else that you feel could also benefit from this video. And from this point forward, I'm going to try to continue posting more videos, and I'm going to take this moment where I have a lot more free time than usual to really start learning how to make YouTube videos and editing videos and making better quality videos. So look out for those in the future. And if there's something in particular that you'd like me to discuss, let me know. All right. Stay safe, stay healthy, and take care of your mental health.